There is a blind spot in general practice, something that many of us don't like to talk about. It's something that's causing untold pain and discomfort, but that comes with a social stigma, which can mean that even those with severe symptoms can be embarrassed to bring them up, think they are normal, or only mention them as a side note at the end of an unrelated consultation. Almost unbelievably, this is the reality of menstrual health in general practice in the 2020s.
Because of COVID-19, I was offered a phone appointment, and my heavy periods didn't feel like an urgent matter, so I didn't mention them. I thought maybe it was lockdown stress. Then it happened again and again.
He told me that the treatment would be worse than the cause, that it would be a big operation. I've since learned that there are other options, but they weren't easy to find, and there was a lot of scary and even contradictory stuff online.
Every month it was crippling. I'd bent over in tears with the pain, but people told me this was normal, and there was nothing that could be offered except sympathy, ibuprofen and a hot water bottle.
Since an all-party parliamentary group identified current treatment practices as unacceptable back in 2016, subsequent reports have shown that while there have been some positives in terms of education and awareness, we still have a long way to go.
Since I spoke to my GP and they were able to help me, I've come to realize that my little menstrual health issue was an urgent issue. It affected everything: my work, my relationships, and even my self-esteem. It was actually horrible.
When I found out that it wasn't a lost cause, that I had choices, it was life-changing. I feel like my life was taken away from me for 7 years. But now I've got it back.
When I found a GP that really understood and could help, I was so happy. My advice is don't suffer period problems in silence. Call your GP, talk to people, and keep talking to people until you find a treatment that is right for you and works.
As GPs, we all want to help, to treat each of our patients with respect and dignity, and reduce their suffering with the right diagnosis and the right treatment as quickly as possible. In order to do that, we need to make a real change right now when it comes to periods and period pain for us and for our patients. To keep up to date, to keep asking questions, and to keep talking to your patients about periods, pelvic pain or other period-related issues. For more information, visit the RCGP Women's Health Hub on rcgp.org.uk/women's-health today.